Hey everyone, I'm John Hammerly with the Plastic Surgery Channel. Today we're going to do, well, I'm going to call it Rhinoplasty 101. All right? Dr. Walker, you're going to lead us through and talk about what you found in a challenge with this one particular young boy, and then we're going to test this young buck over here.
This young patient is actually a very happy child. He's 10 years old, and he was born like this. And, finally came to me because he'd been teased a lot through school and whatnot. And so I decided that I would go ahead and proceed with a full examination, CT scan, all of that. I wasn't sure if it was a congenital anomaly or it was a traumatic deformity or what, and the mother wasn't sure either because it manifested as he grew in age. And so the nose became, more apparent at that time. So go ahead and tell me how you would handle this.
So my concerns would be exactly what you were mentioning, which was congenital. Any midline nasal or midline forehead mass, I would want imaging. So CT versus MRI versus ultrasound, we want to make sure that that is not communicating with the pericranial contents. And so what were the results of that?
Well, they showed that he was just deviated septum and it looked like a fractured nose that was basically what we thought was maybe he was grabbed with the forceps at birth and pushed over the nasal bones and the septum.
Okay. And so as the septum is lengthening as the child is growing, you're getting an increasing deviation in that deformity. And so he's about, I guess, 9 years old. Okay, so 10 years old. So if it's just a deviated septum, and his lower lateral cartilages seem to both be there, and it's not a cleft situation, my goal would be to first have the conversation with the parents that I do believe that this is something that can be corrected. It's going to require surgery. It's going to require an open rhinoplasty. I'd approach and deglove or open up the envelope, access the septum, remove the deviated portion, and then deal with the mid-vault and the lower lateral cartilages as well, because it seems from this picture that that's somehow part of this. And so this could range, I would tell them, anywhere from just a septoplasty to correct what we see here to something more involved, including spreader grafts, lateral crural strut grafts, and other types of grafts that would help sort of reintroduce a normal shape. But like you said, I'm just a young buck, and this is, for me, if this is 101, this seems a lot more than 101, but what did you end up doing?
Well, we could show the after picture.
Sure.
There he is. So what I did do was CT scan and showed, as I discussed, no cranial facial abnormality or anything. And I did an open rhinoplasty and really took a good look at all the underlying cartilages and whatnot. Did a septoplasty and also some scoring of the septum that was left and brought it back to the midline. And then the septum had actually caused some abnormalities, or not abnormalities, but differences in the heights of the lower lateral cartilages. So we addressed that, and trimmed them down to make them even. And then I also did a, he had some problems with his turbinates too, so I also did some cauterization of the inside of the turbinate. I didn't take them off, but we did that. And also out fracture of the nasal bones. I didn't do too much rasping of the dorsum and bringing it down because he was going to grow, and he didn't want to destroy any more of that in the child. So that's what I did.
That's amazing. Beautiful result. He looks even happier now.
Oh, he was, and he was such a nice kid.
And really here he's what, 11 in this picture?
Yeah, and then there's more. You can see the before. I mean, the befores are, these are set up in a, bird's eye view, lateral view, and whatnot. So you can see the whole thing.
Dr. Walker, did you run into any surprises?
Not really, because we was so worked up, during the procedure that I knew what to expect. I was kind of wondering if he might have had some sort of a Tessier type deformity, or like a duplicated septum, or that kind of thing, but he didn't. So it was a little more straightforward than I thought, after I got it opened up and we looked at it, and also the imaging that went on.
So you're grading the young buck over here. What would you give him?
I would give him an A. I thought he did very well.
Excellent. Thanks, you guys. I really appreciate it. For any more information, you should quit right now, Matt. Any more information about rhinoplasties or anything else, please go to theplasticsurgerychannel.com.